Welcome, everyone. Welcome to the ABEM webinar for Program Directors, your guide to ABEM certification. Today, I am pleased to welcome ABEM President James D. Thomas and our certification associate, Wednesday Mireles. They're going to be leading our presentation today, and I'd like to pass things over to Dr. Thomas. Welcome.
Thank you, AJ, and welcome to all the program directors. It's truly a pleasure to greet all of you and to give you this webinar on becoming certified. And we got the question bank will be open for the Q&A if there are any questions. So please put them in. We'll address those later on. So the conversation today is going to talk about ABEM, what we do, your role as program directors, the certification steps, some resources regarding the brand new certifying exam, and to talk a little bit about that, and to talk about the My ABEM walkthrough, and again, your Q&A at the end. So ABEM invests in the specialty of emergency medicine and in ABEM certified physicians. We are setting the standard every day to make sure that physicians are competent to practice and know how to take care of patients, the public we serve on a daily basis. We really focus on this in all of our work and efforts to provide the best standard to get the best care for emergency physician patients coming into our EDs. I want to thank all of you personally. I know how tirelessly you work in preparing these residents and educating them along with your faculty, and it's not an easy role. So on behalf of the board of directors, we want to thank you because we engage with you all the time to be certain that you are aware of what's going on our end, and we try to keep in touch with what's happening in your education of these fine young women who are becoming physicians and becoming board certified. So the certification process is pretty straightforward. There's an application which will occur in 2027, early in the year, and will at that time of applying for certification, the resident can also apply for the qualifying exam at the same time. There was the old oral exam, which retired last fall, that no longer exists, and the certifying exam, which started this past March. We've had 2 administrations thus far, and when that's completed successfully, the candidate becomes ABEM board certified. So again, this is some other information for you. So again, the resident applications are opened early on in May, and they can apply and register for the for board certification and the qualifying exam at the same time. So it's a 2-for-1. And program directors will complete verification of training after graduation. And the resident becomes board eligible once the ABEM receives the verification of training form, which you complete. There is a program director attestation form. This talks about different competencies that the candidate has met in order to be considered board eligible. There are multiple questions there that need to be answered in the affirmative, and the attestation is much more detailed than it had been in the past. So, for example, is the candidate able to manage a difficult airway, or be able to communicate effectively with patients and their families regarding issues which may not be easy to discuss. Attestation counts this year. In the past, it was just a guide and a formative assessment, but now it is actually holding some merit, where if the attestation is not completed satisfactorily, the candidate will not be considered board eligible, and they will not be able to sit for the qualifying examination. So the qualifying exam, again, registration is open, and you can see the dates there. It's a 1-week administration window from the end of October to the first week of November. The qualifying exam is a half-day exam that is done at the Pearson VUE test centers. It's about 300 multiple choice questions. The questions are criterion referenced, and the scores are generally released within 90 days. And generally, it's been much sooner than that historically, but that's the amount of time that ABEM puts out there. So we talk about the qualifying exam standard, and it's a criterion referenced examination, which means that it is basically scored on what practicing emergency physicians should know, with a standard panel that is present to prepare that information and give the information back to the board of directors. It has been a standard that's been unchanged since 2019, so the difficulty has remained the same psychometrically. We've are aware of the drop in the passing score over the past few years. There was a little bit of an uptake this past year. And but again, we don't have good information as to what is happening here. There are certainly some anecdotal reports and different studies that are out there, and ABEM is always engaged in encouraging people to do some research into this area, and we're always willing to share information with those folks as well. All subsequent exams have been psychometrically equated to this standard. So once the candidate passes the qualifying examination, they are now eligible to come and take the certifying exam. That exam began in March. We've had two administrations thus far, one in March and one in May, with over 600 physicians having completed the exam. It is in person at the ABEM Center in Raleigh, North Carolina, and we're measuring different competencies that have not been measured before. So why was this done? Many of you may have seen this slide and this information many times in the past. It was an outcome of multi-year initiative on the Becoming Certified initiative. It engaged multiple voices, over 4,000 people involved in this. They all felt we should maintain our high standards. They agreed with keeping the written examination, which we currently have had for 45 years, but they also felt that we should keep the oral exam, but wanted different competencies measured. And that was the reason why we've transitioned from the virtual oral exam to now back to an in-person exam in Raleigh, which assesses these other competencies. So there are two case types in the new certifying exam. There are clinical care cases, and those will be there'll be four of them. Two will be prioritization cases, one track board and one multiple patients with multiple injuries or a mass casualty situation. And then there'll be two cases on clinical decision making. Each of those runs 15 minutes with examiners present in the room. The second part of the examination are six cases, each being 10 minutes long, with standardized patient actors who will go over content areas of difficult conversations, managing conflict, reassessment, patient-centered communication, and then there'll be two additional cases, one on ultrasound and one on procedures. And those are the two types of cases that are provided in the exam. The sample cases are available. You can see the QR code there. The website has all the different case types. There are videos regarding each case type as well. There's a little synopsis of what it's all about. You can download case materials and references that are all present. There is also, following the video, there's a brief discussion or a debriefing as to how the case went and what it was meant to measure. And these have been met with very good feedback, and the PDs and residents who have seen these seem to be quite happy with what we've provided. So this again is a little bit more in-depth, a little more granular of what the exam would look like. Part one, again, we have clinical care cases, and part two would have the communication and procedure cases. Some candidates will start with part two, and others will start with part one, and then halfway through the exam they flip. So you can see there in the first case in clinical care cases is the arrival at the registration desk at the Hyatt House Hotel, walking over to the ABEM Center, which is about a block and a half away. There'll be an orientation for the clinical care cases for one group, while there'll be an orientation for the CPC cases for the other group. The exam will get underway. There'll be a 30-minute break in between the two portions of the exam, and then the remainder of the exam will go on. Each candidate will receive their specific schedule upon arrival at the ABEM Center at the time of registration. So again, there are practice administrations which have been done. You can see from some of the pictures there, those are the pictures that we took at one of our mock administrations back in the fall. It helped participants understand the content and the format of the exam. They provided good feedback to us, and we certainly value all of that, and it helped to assess the exam validity, and the validity paper has just been released as well. And feedback helped us reflect more clinical situations that were more relevant to everyday practice. I can tell you that the survey after the March administration, the candidates felt that the cases were certainly true to life, and we received very positive feedback overall. So that's certainly a good sign of things moving forward. So again, there's the inaugural certifying exam. You can see another couple of pictures there going on of the examiners that are looking at videos and watching what's going on in the cases. Again, they reflect scenarios experienced in practice. They're assessing competencies not measured on the qualifying written examination. We try to have the best quality and stimuli and task trainers. And the feedback also said that the candidate said they had a desire to maintain these rigorous standards. So overall, the feedback was positive. They felt the stimuli were good, and that the patient actors were also very true to life. So we've had some very good positive feedback. So the certifying exam scheduling survey is out there, and what we do is we actually send the survey out to the candidates who are ready to sit for the exam. This has all been closed now for 2026. All of the assignments have been made for this year. There'll be 7 additional administrations of the new certifying exam, 2 of them in June, 3 in August, 1 in October, and 1 in November. So those are pretty much all filled up, but this would be for starting next year, so early in 2027. The candidates who are board eligible will receive the information to submit preferences. They'll be assigned an exam window in administration. They'll be notified when the registration will be open. They can register for a preferred date and time, and therefore and then they can prepare for their travel arrangements and logistics. So we certainly try to accommodate many needs. We do have on-site AD accommodations, but these must be requested in advance for the accommodation. We have wellness rooms available, rooms for nursing mothers, or other accommodations that may need to be arranged. We try to flex as much as possible for our candidates so they'll be comfortable taking the exam. We know it's certainly a high stakes examination, and we want people to be as comfortable as possible. And that being said, we've stressed to the candidates the importance of coming dressed comfortably as well. So many people come in scrubs. In our first administration in March, about 75% of the candidates wore scrubs. And at the May administration, I guess word got out because almost everybody was in scrubs. And we want people to be comfortable. We're not measuring their clothing, but rather their knowledge and management of emergency medicine cases. So again, the travel and logistics are there. The registration occurs at the Hyatt House. It does not occur at the ABEM Center. We had a few candidates to go over to the ABEM Center, only to be sent back to the Hyatt House. They'll register in a conference room there. Many of the candidates may stay at the Hyatt House. We have a block of rooms available. Certainly, candidates who live in Raleigh in the area may stay at home or may stay with family in the area or other hotels nearby. There are other choices available. We do have the block of rooms available at the Hyatt House. Upon arrival, they'll meet a proctor and some ABEM staff. They'll be given logistics of the day. They'll get their schedules, and then they'll walk over to the Hyatt House the AIM Center rather to begin the administration of the exam. The closest airport is Raleigh-Durham International. That's RDU. It's about a 15-minute drive to the North Hills area of Raleigh, where the exam and Hyatt House are located from the airport, and taxis and ride share options are easily available from the airport. Again, the dress code, scrubs are permitted. We ask that the candidates don't wear institutional logos. We don't want anybody to be biased by this. And although we've done much in training of fairness and bias, we think it's just better that no institutional logos appear on people's scrub wear, and people can wear whatever they're comfortable with wearing. So again, the resources are available on the website. We talked about this already, where there are sample cases and videos, debrief videos. There are references and summaries available. The procedure and ultrasound lists are also available as what's considered fair game. This is all coming from the EM model. Scoring guidelines are there, and the Know Before You Go guide. And again, all the orientation videos are also there. And as more and more information becomes available, ABEM will continue to put this information on the website, not only for you as program directors, but for all of the candidates who will be seeking board certification. And we're often asked, so how do we prepare the residents for this? And the residents ask us, how do we study? And I tell them to just be the best emergency physician that they can be and to seek feedback from you, from their faculty, and from their program directors. The new exam assesses the types of skills they use every day. Basically, discussing cases with an attending, presenting the case, going back and forth with plans and differential diagnoses, prioritization cases of who should you see first when it's a busy department. And with the communication cases, certainly delivering bad news, managing conflict, And I've stressed them the importance of going to talk to families with faculty and listening to how faculty, you as program directors and your other faculty will engage with patients and families. And again, the resources available on the website should be very helpful with this as well. Scoring is criterion reference. There's no curve. Standard setting processes are established, and this is done to have a passing threshold. We have a diverse group of emergency physicians, all board certified from different levels of practice, different scopes of practice, different years from time of initial certification. We look at people from all over the country to get together and to prepare the standard setting process. They'll evaluate the exam and they make a recommendation of what should be considered passing score to the board of directors. This is presented to the board of directors in another meeting, and then a passing score is set. If the standard is met, the candidate will pass the exam. So in terms of bias and fairness in testing, we've been accredited by the National Association of Certifying Agencies, that we've really done our due diligence to limit bias as much as possible. So there's bias training that's been provided to all staff, to all the item writers and case developers, and to all of the board of directors. Our cases undergo bias review by multiple people. We have experienced professional patient actors who interact with all of the candidates, and this is to help increase reliability. And the examiners are evaluated for administration and scoring accuracy. So we're being certain that everything is being done on the up and up. We have interrelated reliability with cases being scored by multiple people, and scoring and equating process adjusts for variances in scoring stringency. So we make certain that it's fair to everybody involved. So if some examiners are a little bit tougher than others, that they're not going to be, a candidate would not be unfairly scored because of that. And there are psychometric analyses that are done on all of these. So there's a validity paper that came out just a couple of months ago, and both examiners and candidates and examiners rated cases as clinically accurate and relevant to the practice of emergency medicine. We're very pleased with the report that was released, and case instructions and prompts of the cases were generally clear and understandable. There was no confusion. Again, there's no role playing this exam. It's basically interaction with an examiner or interaction with a patient actor. And again, we all have shared interests. You want your residents to be prepared and to pass the exam, and ABEM wants the residents to pass as well. We want our candidates to do well, to pass our exams so they can get board certification, and they can be the future of emergency medicine to care for all of us when we're in need of emergency physicians to take, in the future if we get ill. And we also promote ABEM certification to have value, and to value not only by the hospital system, for the insurers and the public, but also for the individual themselves. So this is important to all of us, that the ABEM certificate has value for everyone. And we're here to support you. If there are any issues or questions, we do interact with CORD and have meetings with them periodically. If there are issues that come up that need to be discussed, we're always open to discussion with the program directors. We want to work in partnership with you as you train what we think are the finest and brightest physicians to become board certified emergency physicians going forward. We also provide ongoing support. So once certified, we promote value and expertise as a specialist. We work tirelessly with a group called COBSEB to forego merit badges like PALS and ACLS, basically telling credentialers and hospitals that board certificate by the American Board of Emergency Medicine far supersedes any type of merit badge form from ACLS or for PALS, because we feel that we've far surpassed those merit badges in the rigor that we promote in our maintenance of certification, continuing certification process. We provide those resources to promote certification. We want people to stay current and stay certified. We have numerous volunteer opportunities. Obviously, with 9 administrations of the new certifying examination, we're always looking for help. This takes a lot of people power to bring the exam to fruition and to get it to kick off and to run on the week that it runs every few weeks. And we listen to your feedback, like I mentioned earlier. We really appreciate all that you do for us and really couldn't do it without you. And you can see some of the resources there at abem.org. And with that, we will transfer the talk over to Wednesday, who's going to provide some more additional information to all of you on becoming certified, and we'll stay available at the end to answer any questions in the chat. Thank you very much. Wednesday.
Thank you, Dr. Thomas. And again, thank you for the program directors for being here. So yeah, if you ever go to abem.org, this will take you to our landing page. The Get Certified tab that's circled there in red will take you to the roadmap of on how to become certified. Information related to your role as program director can be found in the subsection under the Get Certified tab at the top there. If you're ever curious, it'll have information related to you about credit and equivalent credits, just any general information related to, again, to your role as program director. And to use My ABEM, our new My ABEM portal is available to you. If you My ABEM sign in, you can update your contact information, view resident training information and residents, and then as well as scores and complete requirements, as well as check your status for your My ABEM certification. And this will take you to the landing page of your MyABEM sign-in. If you ever forget your password, just go ahead and forget password. If that does not ever work, just go ahead and email us again at myabem.org. And once you are signed in, this will be your My Certification dashboard to maintain any of your certification related activities. To get to your program director dashboard, you want to just go ahead and select the drop down menu, and this will go ahead and take you to your dashboard of your program director related activities to view any information related to your program, such as your resident roster, in training examination, and such anything on your left hand side menu. For the in-training exam, you'll want to go ahead and just select in-training examination on the left-hand side, where you'll go ahead and see your program. If you are a program director to multiple programs, you'll go ahead and probably see a few lists, a couple other sections for your other program. So you just want to make sure that you're selecting the correct program when you register. And then to begin the registration, you'll go ahead and just select View Details right there on the right-hand side. And then from there, you'll go ahead and begin. The registration period is for next year is available to you on your MyABEM portal. And then once you select here, you go ahead and see these dates here. Again, those dates are available to you on the MyABEM portal. The registration will begin earlier this year, September 22nd through December 15th. And then the dates for the next 2027 administration is February 23rd through February 27th. And to verify your residence training, typically that will begin and available to you once they graduate residency, which is typically on July 1. You'll go ahead and select Verify Training right there on your dashboard, which will then take you to your list of residents to verify. On your Unverified tab, you just go ahead and begin to select Verify. And it will then bring you to the attestation to where you can go ahead and select yes. Again, the attestation will now count towards their board eligibility. Once that is complete, you'll go ahead and see on the Verify tab, you'll select Verify, which will then switch to your verified attestations where you can select View Details. And then from there, you can see that they are now board eligible and verified. And again, any questions, you can relay them to abem@abem.org or give us a call at 517-332-4800, option 3.
Thank you, Wednesday, and thank you, Dr. Thomas, for sharing this information. We do have a few questions coming into the Q&A, and just a reminder for everyone, the Q&A box at the bottom of your screen is open, and we'll take a few questions now live. We did get, excuse me, a question about the 2027 certifying exams. Do we know or anticipate when the 2027 exam dates will be released?
So as far as I know, we do have the dates available and they will be released shortly. I've not received any final word as to when they should come out exactly, but from what I understand, we do have dates secured, so those should be released pretty soon. AJ, you may have a little more information about that as well, but I have seen some of the dates.
Yeah, I think you're right on track. I've heard as well that they'll be released this summer and possibly even by the end of June. So programs and residents can begin preparing for 2027. Thank you. Wednesday, we have a question about the verification form. When will program directors receive notice that they can go and do that?
So we send out notifications sometime after July 1 to ensure that all of the training verifications are completed. And then periodically we'll send reminders throughout the year to ensure that we have them before the qualifying exam begins.
Thank you. We have a question about the in-training exam as well. Do we know the 2027 dates, or are we able to post those?
The in-training exam dates for 2027 should be around the end of February. I don't have the dates in front of me, but I'm certain they're available by this point.
The examination dates are February 23rd through February 27th.
Thank you. I wanted to follow up on a question that we have about the certifying exam. Dr. Thomas, are there additional procedures that will be released or in the procedures list?
The procedures list is what's available right now. The things that are on the list would be considered fair game for an examination. Going forward, these may be adjusted as need be to follow the EM model of practice. But for the time being and for the administration, I would say over the next year, what is on the website is what is considered testable.
Thank you. We have a question coming in about the program pass rates. Have there been feedback provided on the program pass rates and ABEM publishing those to date?
Please repeat the question.
Yes, has ABEM received feedback on publishing the program pass rates?
The pass rates were released back in the fall, and this went through quite a big process of figuring out how we were going to do this. And I can tell you that there was very little feedback. In fact, we were thinking that we may have been receiving some additional feedback from hospitals and PDs and chairs and residency programs, but in fact, we received very little feedback. It seems to have been well accepted by the emergency medicine community. So I'm happy to say that we feel we're being transparent with medical students who are applying to programs, and it wasn't meant to be punitive for anybody, but just letting people know how what the pass rates were, and hopefully encouraging programs that maybe didn't do so well to get the help to by the other programs that did extremely well to make everybody better overall. That's the goal of this. Is if everybody's great, then it's perfect. That's what we really want.
Thank you. We have another question back to the certifying exam and questions about scoring rubrics or additional scoring information. Is ABEM putting out any additional information on that?
So the scoring information is available on the website. We're not disclosing any further information at this time about what we're looking for in terms of actual scoring elements. So the information that's available at this time is what ABEM is releasing. Going forward, there may be more information coming down, but as of now, the information that's available is what we have.
We have any other additional questions for the Q&A? We'll give everyone a minute to add in additional questions. There is a question about the program pass rates and if ABEM is considering an opt-out button for graduates to agree to have their exam pass rates sent back to their programs. Are you aware of this, Dr. Thomas?
So yes, there is some discussion about allowing the candidates to allow their scores to be released back to their programs. This was in discussion as recently as last week at SAEM, and the board is looking into this as well. Again, the information is the candidate's information, and because of privacy and our accreditation by the NCCA, the candidate would have to opt in to allow their scores to be released. But yes, the ABEM is looking into this, the board is looking into this, and staff as well, to see how we can make this happen.
Thank you. Question for Wednesday. The new My ABEM platform is up and running. There's a question here about if they have any trouble logging in or if their residents do, who should they contact?
Yeah, so as a program director, it's probably best to contact training@abem.org. That's probably the quickest way, or you can also email abem@abem.org. Both emails work. And for your graduating residents or any resident, they can email abem@abem.org or application@abem.org. And then again, our main contact line, the 517-332-4800, just any I believe it's option 6, so that way they can be helped by phone if y'all need assistance as well.
Great. We have questions about volunteering for the exam. Dr. Thomas, do you know if AOBEM boarded faculty are able to become examiners as well as ABEM certified?
As of this time, only ABEM certified emergency physicians are able to participate as volunteers in the exam. And that's been the tradition of the board for some time. So I don't have any additional information aside from telling you that at this point.
Thank you. In terms of the certifying exam, you talked about the success of the first 2 exams. If someone were to not pass the exam, how do they get back into taking the exam in future years?
So what would happen is they would have to wait a minimum of 9 months prior to being able to take another or subsequent examination. The reason for that is because of case changes and case equators that are going on in the exam process, and we wouldn't want to have candidates seeing the same cases, repeated. Some of them, here and there will be showing up in multiple examinations because of a psychometric analysis. So basically, because of that, a candidate would have to wait a minimum of 9 months, and the board office would help to arrange the situation to allow them to sit for an exam in the upcoming cycle.
Thank you. Wednesday, we have another My ABEM question asking, when do residents get their first profile set up? Is it during their first year of residency?
Yes, during the first year of residency, the program will enter their first year residents, and then from there, it'll then create their profile. And then from there afterwards, they'll receive their activation email.
Great. Give just a moment if anyone has additional questions they'd like for the Q&A. This is probably for you, Dr. Thomas. We have a question about the PD attestation form. If they receive a successful attestation initially or if they did not receive, I'm sorry, a successful attestation initially and later successfully remediate that, does the program director then resubmit the PD attestation, or do we know how that process works for them?
Yeah, that's a very good question. I'm certain if at that point, if the candidate has met all of those milestones, the PD would need to probably reach out to the ABEM office to inform the office of the situation to allow that candidate to be considered board eligible. There may be a repeat form that needs to be completed, but I'm not positive about that. But certainly, a question like that can be brought up to the ABEM staff for the right answer.
Great. Guess we can make that information available and find that out for everyone. Awesome. Well, I appreciate everyone's time today. And again, thank you to our program directors and all of your work. If anyone has any questions, they can reach ABEM at abem@abem.org. And thank you, Dr. Thomas and Wednesday, for your time today.
Thank you.
Thank you.